The NHS faces a worst-case scenario as a tidal wave of flu hits. Hospital admissions in England spiked by 55% in a week in a service already crippled by waiting times and corridor care.
It's 10 o'clock. This is Sky News at 10. Our top story. A worst-case scenario. The NHS warns the health service is battling a deepening flu crisis as hospital cases rise by more than 50% in a week. Good evening. Winter has barely begun, but tonight we've had a warning that the NHS is facing a worst-case scenario, December, with a surge of superflu. Latest figures show the number of people in hospital in England with flu remains at a record level for this time of year and has increased by 55% in the past week. Health bosses say there's no peak in sight. The surge is being driven by a new strain of the virus and has led to calls from some for those with symptoms to wear masks.
It's been called the Flunami, a wave of flu cases that's come 5 weeks earlier than normal, caused by a mutated virus called Subclade K. Latest NHS statistics show an average of 2,660 beds were occupied by patients with flu each day last week in England, enough to fill 3 big hospitals. It's a 55% rise from the week before, and the NHS says it's facing a worst-case scenario for the time of year.
For that contentious issue of mask wearing, some hospitals say it is going to be mandatory, but for the general public, the government says you don't have to wear one. But NHS bosses say if you are feeling poorly, it's sensible to do so.
What's up, folks? It's RD here, once again bringing you more unwatchable content, and in today's video no one is going to watch, titled Subclade K. It's starting to sound a lot like COVID. See what I did there? A little seasonal play on words, as it is the season for glad tidings and festive cheer, and in the midst of it all, Subclade K is beginning to start to rise and have an impact on the United Kingdom's National Health Service as they are bracing themselves for their worst case scenario. And from those few clips that you witnessed at the start of this evening's unwatchable video, you may have noticed that a couple of references to wearing masks have happened to begun to circulate. And not only that, within the United Kingdom, within the last week, there has also been numerous schools that have closed down as Subclade K is on the rise, and students were sent home, and schools closed down because a number of individuals and classmates had come down with this latest mutant variant of the influenza H3N2 Subclade K, and we're already hearing in the United Kingdom that hospitals are beginning to already struggle to cope with the rising amount of people showing up with symptoms for Subclade K. And not only that, within the last week, there's also been a few more news articles circulating in the United States that indeed Subclade K is on the rise there too. So don't worry about this being a long one. It is a Subclade K update. It's not going to be a very, very deep dive, but it is a story that I started following 3 weeks ago now, or maybe 4 weeks ago at time of recording, as I noticed this story developing regarding Subclade K, and it was the first thing that really alarmed me was the fact that they give it a name, because it's going to be obviously very easy and marketable to, rather than just calling it influenza H3N2. They've named it, and that I think is a purposeful act so that it will be able to be used in the publications, newspapers, news reports, mainstream media, and more than likely memes and YouTube channels are going to be talking about Subclade K in the coming future, I predict. Now, I don't see any lockdowns or major pandemic announcements this side of Christmas, and can't really predict that this is going to happen the other side of Christmas. With these stories, I said that it does start to sound a little bit like COVID. It does echo of the pandemic, how that began in a far off land overseas in Asia, and we've already discovered that Japan was the first nation to start struggling with Subclade K and has already declared an epidemic for it there in Japan. And similar to COVID, this started out in China in the province of Wuhan, and China was one of the first nations to start lockdown and some of those draconian measures that were put in place to combat that rise. And little did it do, as it did develop within a few months into a full-blown pandemic, as we well know. And as I said, this time of Christmas, I doubt anything is going to be locked down or shut down other than schools, perhaps, because it is, of course, coming up to Christmas, and it is an extremely busy time of year for consumerism. So I'm guessing that before they declare any lockdowns or any sort of drastic measures, or if they do that, I'm not saying that they are going to, as I said, make of it what you will, folks. I'm just reporting on a developing story, but as it is consumer season, I'm guessing that they will wait till after everybody has spent their money and run up their credit card debt, providing presents and gifts and all the other insundries that go along with this commercial time of the year. So without me rambling on any longer, let's dive into today's content with our first article of the day. So let's start out at the NHS itself, and this is their website, which is a part of the United Kingdom government, and it starts out by saying the NHS is facing its worst case scenario. December amid super flu surge, 11th of December 2025. This was released within the last 24 hours at the time of recording, but it starts out, flu hospitalizations have surged by more than half in just 1 week, plunging the NHS into a worst case scenario. NHS is National Health Services, if you are unaware of what that stands for, but I do know that we've got a couple of people that do watch from the United Kingdom, so this will be sort of particularly relevant to you. But it's a worst case situation for December, with new figures revealed today, and an average of 2,660 patients per day were in a hospital bed with flu last week, the highest ever for this time of year, up 55% on last week. So they've literally 55% more people this week than last week have reported symptoms of influenza, in particularly Subclade K, which is making up 90% of those cases by all accounts. But it does mean there are enough flu patients each day to fill more than 3 whole hospital trusts. So that's quite alarming. The NHS chiefs have warned that the total has already increased sharply since the week covered by the data, with no peak in sight. The number of norovirus patients, that's something we heard about in the second Subclade K video here at NoOneWatchesArDee, deaths in the USA, in which we heard that there had already been 1 or 2 deaths recorded in a couple of states in the USA the week before this. The number of norovirus patients, the article continues to say, in hospital bed has also risen by 35% to an average of 354 each day last week. So that was something that was highlighted in that last video about Subclade K, that norovirus was already on the rise, and that you should be looking out, what are the symptoms between influenza and what are the symptoms of norovirus, to determine determine which of these two rampant illnesses you may have, in God forbid, and may the force be with anybody who develops both at the same time. Can you only imagine? But it comes as a demand for A&E, accident and emergencies, and ambulance services is already soaring. New monthly figures today show that A&E, accident and emergency attendances, were a record for November at 2.35 million and more than 30,000 higher than November of 2024. While there were 48,814 more ambulance incidents compared to last year, which are the numbers are there, 802,525 versus 753,711. The record-breaking demand comes with thousands of resident doctors set to go on strike from the 17th to the 22nd of December. So in the midst of a flu surge and a norovirus outbreak, NHS doctors have decided to go on strike for a week, sparking fears of major disruption for patients ahead of Christmas. Now, another thing, Christmas is another busy time of year for travelling, where lots of people do tend to sort of go and see families and relatives they may not see all year round. Maybe not so much in the United Kingdom, but certainly within the United States, people will be jumping onto airplanes and going back and forth across country and possibly having to change flights to do so. And, you know, interactions within hospitals and airports are certainly places for viruses to thrive and spread. But the NHS is urging anyone who is eligible to get their flu vaccination to help prevent them getting seriously ill. Today's data shows more than 17.4 million have been vaccinated so far this year in the United Kingdom, and that is over 170,000 more than this time last year. Over 60,000 more frontline healthcare workers have had their flu vaccinations this year compared to a similar time last year, with thousands more expecting to get jabbed in the coming days. The average ambulance response time for Category 2 emergencies, including strokes and heart attacks, was almost 10 minutes faster than in October 2024 at 32 minutes 46 seconds. Figures also show that the NHS waiting list in October rose slightly by 6,002 to 7.40 million, an estimated 6.24 million patients. So currently in the United Kingdom, over 7 million people are waiting to get medical health assistance courtesy of the NHS. As opposed to 6.2 million patients this time last year, but significantly lower than a year ago. Actually, sorry, I read that wrong. It's actually lower this year than it was last year, so less people are waiting for medical treatment, although I'm sure with this flu surge, super flu surge, then that might change in the coming week. Sorry for that. Meanwhile, 2.62 million vital checks and tests were performed in October, the highest on record, over 100,000 up on the previous month and nearly 62,000 above October of 2024. As demand on the NHS surges, it's bracing for another 5 days of industrial action by resident doctors, which begins at 7 a.m. next Wednesday, the 17th of December. The public are advised to attend any planned appointments scheduled during the strikes unless they have been contacted to reschedule. Primary and urgent emergency care services will continue to be available for those who need them. The public should use 111 online as the first port of call for urgent but not life-threatening issues during industrial action, so that they can be directed to the best place for their needs. Patients who need emergency medical care should continue to use 999 or come forward to A&E as normal. Professor Meghana Pandit, who is an NHS National Medical Director, said, with record demand for A&E and ambulances and an impending resident doctor strike, this unprecedented wave of superflu is leaving the NHS facing a worst-case scenario for this time of year. with staff being pushed to the limit to keep providing the best possible care for patients. The number of patients in hospital with flu is extremely high for this time of year. Even worse, it continues to rise and the peak is not in sight yet. So the NHS faces an extremely challenging few weeks ahead. NH staff have pulled out all the stops to vaccinate more people than last year, and with just a week left to ensure maximum immunity from flu for Christmas Day, I would urge anyone eligible for the vaccine to please book an appointment or visit a walk-in site as soon as possible. Vaccination is the best protection against getting potentially very ill, and it could also help protect those around you. We have the NHS that is prepared earlier for winter than ever before, and stress-tested services to ensure people have a range of ways to get the help they need and avoid needing to go to A&E. For non-life-threatening care, people should call NHS 111 or use 111 online, which can direct you to the most appropriate place, and use A&E and 999 for life-threatening conditions and serious injuries. Nearly at the bottom, folks, don't worry, it's not going to go on much longer, but Health and Social Care Secretary Wes Streeting said there is a tidal wave of flu tearing through our hospitals. We are working with the NHS to make sure it's able to cope with this as best as possible, including already getting over 17 million patients vaccinated, 170,000 more than this time last year, with over 60,000 more NHS staff already getting their jab. We've heard that in this article before. Repeat is the way to ensure lies will be accepted at truth. I'm not telling you to believe that this is lies. I always tell you, make of it what you will, but the NHS have been a little bit known for being untrustworthy in the past. Let's just leave it at that. But we have recruited 2,500 more GP, general practitioners, and modernised GP appointment booking, keeping patients cared for in the community and out of hospital. The offer I have made to the BMA would be help solve the jobs problem resident doctors are facing and bring an end to strike action this Christmas, which is the most dangerous time of year. I urge resident doctors to not inflict further damage on the NHS. Vote for this deal and call off the Christmas strikes. So there you go. That was an article from the NHS, from the United Kingdom, an official sort of government website, if you like, telling you that they are already in a worst case scenario December as a result of this new superflu subvariant Subclade K. So we're going to go and look at an article that came out within the last hour about school closures in the United Kingdom. So here at the independent.co.uk, the article reads, schools forced to close as teachers and children are hit by the flu outbreak. One school told parents it would move to remote learning due to rising flu cases. Where have we heard remote learning from? How long is it going to be before remote working is also added to the list of growing things that are sounding an awful lot like COVID? And this is from Friday the 12th of December 2025 at 16:10 Greenwich Mean Time, which is within the last hour at time of recording. So this is almost fresh off the press, folks. Flu outbreaks are severely impacting schools across the United Kingdom, leading to a significant drops in pupil attendance and critical staffing shortages, a leading union has warned. The widespread illness has already forced some institutions to close their doors. One school in Cornwall recently shut down due to an unprecedented and increasing incidence of both flu and strep. We haven't heard about strep yet. There's another thing to be concerned about if you're in the United Kingdom. But following several similar reports of closures over recent weeks. We've got to scroll down quite a bit till we get to the next part. And here it is. This This comes amidst a national surge in influenza cases, which have jumped by 55% in just 1 week. The Health Secretary has cautioned about a tidal wave of flu, tsunami. We're in a lot of sort of aquatic references or nautical references to this sweeping super flu epidemic that is obviously causing problems, as we are discovering in the United Kingdom. How long is it going to be before Canada follows the United Kingdom's trend in seeing a rise in Subclade K victims? But Paul Whiteman, a General Secretary of the NAHT School Leaders Union, stated, "We have seen flu outbreaks in schools having an impact on both pupil attendance and staffing levels." And again, a little bit further to get through till we get to the next part. And he added that while schools are striving to minimize infection spread, closures remain a last resort, despite some isolated cases already occurring. There is a picture, I believe, of the school. Bude Haven Community School in Cornwall said it would move to remote learning over Thursday and Friday due to rising flu cases. Wish I never clicked on that, but it's just a picture of the school. We're not missing anything there. But in a letter to parents on Wednesday, Bude Haven Community School in Cornwall said it would move to remote learning over Thursday and Friday because of the current unprecedented, and that's another word we keep hearing, unprecedented and increasing incidences of influenza, in brackets the flu, and a Group A streptococcus infection amongst our pupils, sixth form student and staff populations. What's going on there to spread strep among the staff and students? One can only wonder. But the schools said it was hoped closing would reduce the spread of illness, and confirmed on Friday it planned to reopen as normal on Monday. So we're not closed down for that great length of time, but 2 days already a school was shut down and resorted to remote learning as a way to combat this spread of influenza. But meanwhile, Radwinter Church of England Primary School in Essex is also closed this Friday and Monday, so they're not opening up on Monday, and that is due to a norovirus outbreak. So we've got a lot of medical conditions at large at the moment, folks, so brace yourself. It could get mucky before it gets unmucky. Not sure where I was going to go with that, but never mind. It was reported last week that St Martin's School in Caerphilly had also closed after more than 250 pupils and members of staff fell ill. Congleton High School in Cheshire shut temporarily in November. It was reported for a deep clean after several cases of illnesses. There's a picture, a stock photograph of a UK health security agency urging Britons to take their last chance to be vaccinated against the flu in time for Christmas. It's your last chance to get vaccinated against the flu in time for Christmas. Quite daunting there. But NHS figures released on Thursday, which we just read, show the number of people in hospital in England with flu remained at a record level for this time of year, and it has jumped by 55% in a week. 55. Oh, that's EE. 66 would have been FF. Never mind. Meanwhile, in the last week of November, 107 new incidents of acute respiratory illnesses were reported in education settings, in schools or colleges, universities, that type of places, and a large increase on the previous week. The latest UK Health Security Agent's figures show. Earlier this week, Simon Kidwell, a head teacher at Hertford Manor Primary School and Nursery in Cheshire, told BBC Breakfast combating flu had been a real challenge. The winter bug spread really easily in schools, he told the show on Monday. We do know that we can do things to make sure that it's safer in schools, but we've seen schools closed to us in Cheshire. closed for 3 days. So it has been a real challenge this year. And is that all of the article? I believe it is. Yes, it is. We have in fact got the end to it. So there was an article from the independent.co.uk about schools being forced to close.
NHS faces a worst-case scenario as a tidal wave of flu hits. Hospital admissions in England spiked by 55% in a week in a service already crippled by waiting times and corridor care. One paramedic told Rebecca he dreads his work.
I feel physically sick. I don't want to go to work because I know for a fact that the next 12 hours are going to be absolutely horrendous. You know, the public are going to be let down. There's no dignity.
In an overloaded system, a surge in flu is the last thing the NHS needs this Christmas. The PM says a winter plan is in place, but can it survive this? Also on News at 10 tonight.
We are Russia's next target. Russia has brought war back to Europe. And we must be prepared for the scale of war our grandparents and great-grandparents endured.
A chilling warning from the head of NATO as Zelensky floats an updated peace plan for Ukraine.
It's embarrassing as well. Look, everybody's about, everybody can see.
The horror of eviction and the fear of not knowing where you'll sleep as the government unveils its homelessness strategy. Dan assesses if it'll work. How much? Outrage at ticket prices for the FIFA World Cup, 5 times higher than in 2022. And can you believe your eyes why Time magazine has named the architects of AI as their Person of the Year?
This is ITV News at 10 with Julie Etchingham.
Good evening. The words of the Health Secretary, Wes Streeting, echoed across the wards and, yes, along the corridors of hospitals in England today as the latest flu figures were published. There is, he said, a tidal wave of the virus tearing through them. It's not much better in Scotland, Wales and Northern Ireland. The average number of people with flu needing hospital treatment last week was more than 2,500, up 55% on the week before. A more infectious strain is being blamed for the pressure on hospitals that we've covered over the past week. Since our first report, more than 500 people have been in touch about corridor care.
In the last week, we've been contacted by hundreds of people, laying bare the human cost of a health system in crisis. Patients left soaked in their own urine, unable to sleep under fluorescent lights. Simply hopeless scenes.
I felt awful, absolutely awful. I was shutting my eyes, trying to shut it all out.
76-year-old Lynn went into A&E in pain, vomiting and shaking, but was met with a horror show.
There's the blood on the floor.
She had to wait 10 hours on a chair in the waiting room, then 16 hours on a trolley waiting for a bed.
The noise of people shouting and coughing and in pain. It made me want to cry for everybody there because it just was an awful situation to be in.
Arrow Park Hospital on the Wirral has apologised to Lynn, saying staff are working exceptionally hard during an extremely busy time. The latest data shows that's true across England. More than 2,600 patients a day were in hospital with flu last week, the highest ever for this time of year. More than 2.3 million people went into A&E last month, a record for November. The number of them who waited more than 12 hours for a bed stood at more than 50,000. That's around 5,000 more than this time last year. And for those calling ambulances for things like a stroke, the average response time was more than 32 minutes, well over the long-standing target of 18 minutes.
We're letting them down at every single step of the way.
Mark knows the pressures firsthand. He's a paramedic and contacted ITV News to speak out about the reality on the front line.
What's it like for you going to work at the moment?
I feel physically sick. I don't want to go to work because I know for a fact that the next 12 hours are going to be absolutely horrendous. You know, the public are going to be let down.
Are you having to leave patients in corridors to be cared for?
Yes.
How does that feel?
We shouldn't be leaving anybody in the corridor. There's no respect for the patient there, there's no dignity, there's no confidentiality. We've had people who've been suffering with strokes, who've been left in the back of ambulances for hours.
What impact is all this having on you?
Me, personally, I'm starting to suffer with anxiety.
On a visit to Norfolk today, the Prime Minister responded to our reporting.
Well, these are very concerning. We absolutely need to bear down on that. Nobody wants to see those conditions or patients dealt with in that way. We have invested hugely in the NHS, the biggest investment in the budget that's ever been put into the NHS. The NHS was brought pretty much to its knees by the last government. We are turning that around.
But turning this around is clearly taking time, increasing the risk of it becoming the norm. Rebecca Barry, News at 10.
Well, much of the strain on the NHS is a result of the mutation of flu in circulation. Martin's been looking into it and the effect it's having. And I know you're going to give us the picture around the whole of the country, Martin, and tell us a bit about this strain and why it's causing so much havoc.
Yeah, absolutely. We heard that headline figure in Rebecca's report. 2,660 patients in English hospitals. That's the highest number we've seen at this time of the year. And in fact, it's 55% up on last week, which was also a record. If we look at Scotland, well, hospital admissions up there too. They rose by 15% to 986. In Northern Ireland, there were 1,184 new cases in the first week of December. That's an increase of 24%. And in Wales, there were a total of 254 patients in hospital with flu last week. And a lot of it, as Julie suggested, is to do with this new strain of flu we have this year. It's called H3N2 Subclade K. And scientists from the UK Health Security Agency have been tracking it as it's become the dominant strain. In fact, it now accounts for 90% of cases.
We know that H3N2 viruses, they do cause people to have disease. They cause hospitalisations, particularly in some of those more elderly age groups. But there's no indication that this particular subclade of H3N2 is more deadly than what we've seen before.
So the risk really is that the transmissibility, how easy it is to pass on.
Yes, so the strain does appear to be more transmissible.
Which leads us to the big question, does the vaccine still work against this new strain? And early data suggests, yes, it does. Amongst children, the vaccination is estimated to cut the chance of being hospitalised by 70 to 75%. In adults, it's lower, down at 30 to 40% reduction, but that's actually similar levels of protection we've seen in previous years. Now, in terms of uptake, if we look at the risk groups, those who are entitled to a free jab, well, more than 70% of people 65 or over have been vaccinated, which is above previous years. But rates amongst people with underlying health conditions, and as you can see on the bottom line there, pregnant women are significantly lower, and people in those groups particularly are being encouraged to get vaccinated. Now, it's worth noting, if you have had the vaccine, it can still take 14 days for protection to kick in. Even then, you can still get ill. The chances are, though, your symptoms will be milder and hopefully you will get better a little bit quicker. As for that contentious issue of mask wearing, some hospitals say it is going to be mandatory, but for the general public, the government says you don't have to wear one. But NHS bosses say if you are feeling poorly, it's sensible to do so.
OK, Martin, thank you very much indeed for that. And Rebecca joins us now as well to talk further about this. And you've been reporting on this right on the front line. It's really a terrible picture. We also know that this flu surge hasn't peaked yet. So is it going to get worse before things get better? And can this plan that the Prime Minister says is in place survive it all?
Well, it is likely that flu cases will continue rising for a few more weeks before things get better. Look, at this time of year, as winter pressures begin to bite, I go into hospitals and we film, but I've been really struck by the hundreds of videos and photos and stories that we've received from members of the public. I think they give a really raw insight into the reality on the front line for patients and for staff. I mean, in that interview with a paramedic I met earlier, he said he dreads going into work. That's a sign of the psychological impacts that this is having on staff. I mean, let alone the potential physical harm to patients. Today's figures show that winter pressures have hit the NHS early. But ask anyone in the health sector and they will tell you that these rising flu cases are only exacerbating the existing pressures that the NHS contends with year round now. Plus, we've got the potential threat of a doctor's strike beginning next Wednesday. We'll find out on Monday morning whether or not that's going ahead. But by then, some people will already have had their operations cancelled. Staff will be making contingency plans, and all this in the midst of this unprecedented flu season.
It's a really difficult picture, isn't it? Thank you very much indeed, both Rebecca and Martin, for taking us through it. And for more on the current strain of flu and how you can keep yourself safe, just head to our website, itv.com/news.
Next up, we are at the Daily Telegraph from the UK, from an article that was first publicised the 10th of December 2025, just a couple of days ago. And this article reads, "School cancels Christmas because of flu." School cancels Christmas because of flu. Let that sink in for a second. A school play and festive lunch is abandoned as they would not be safe. And you can gift this article for free if you so wish. What a shit gift that would be if anyone did gift this. And as I said, 10th of December 2025, 9:53 a.m. Greenwich Mean Time, it was publicised. But a primary school is cancelled Christmas because of the flu. Southbank Primary School in Middlesbrough, North Yorkshire, said it would not be safe for Christmas lunch performances and craft days to go ahead because a tidal wave, we've heard that an awful lot, folks, already in this short stream, tidal wave, tsunamis, super surge of mutant strain of the flu has left a record number of patients in hospital for the time of year, and 3 schools have already been closed. Parents were expected to join their children at the Southbank School for a series of festive events over the coming weeks. These included Christmas dinners for parents and children on December the 17th and 18th, Christmas plays on December the 9th and 10th and 11th, and a craft day on December the 12th. But Tammy Cooper, the school's headmistress, said it would never be safe for the events to go ahead, as it was important to prevent a significant outbreak of flu among pupils and teachers spreading further. I don't know why I read it like that, I just imagine that's sort of how Tammy might sound. But the infection rates are highest among those aged between 5 and 14. A daily share of flu tests returning positive by age group, and there's a graph there of some squiggly lines and numbers, but due to a significant outbreak of staff and children coming down with influenza, I feel that it would not be safe to bring the school community together at this time, she said. And therefore, I have made a difficult decision to cancel all Christmas parental engagement activities, Christmas performances and Christmas lunch. Christmas is cancelled in Middlesbrough for children and families that who knows, they may be their only chance to experience a little bit of festive cheer. People are on a low income and struggling to sort of pay the bills, so a little bit of festive cheer provided by the school might be the only festive cheer some people might be getting. And unfortunately, got to keep you safe. No Christmas for the children of Middlesbrough, or not all the children of Middlesbrough, just the children and the parents of these 3 schools. But the children and staff have worked so hard on their performances, and we'll share the videos of our performances on Facebook page, so you can enjoy it remotely, folks. You're starting to see a pattern. The school's nursery nativity had already taken place on December the 8th, and that's lucky, but children will get sick from mixing in classrooms. Parents have told how their children will be upset when they find out about their head teacher's ruling. Jay Jones said her daughter will be absolutely devastated. She waited weeks to show me her Christmas play, she said. More patients in hospital for flu this year, as we've already established in this video. A number of hospital beds occupied by flu patients, week 49 in England. There you can see over 2,500, up quite considerably. Look at that, 2021, there's like practically nobody in a hospital bed for influenza. Tony Lee Brown said, just tell people to wear a mask, miss, and if not, they can't come. See what I'm saying, guys? It's starting to sound a lot like COVID. Wear your mask and get jabbed. Christina Walker pointed out families would get ill from sick children mixing with each other in classrooms anyway. She said, should the school be closing for a deep clean? Sad for all the kids. And now deep clean's another thing we've heard a couple of times mentioned in this video from various articles. But I know my daughter was so excited for us to go to school and watch her play. I think it's the right decision on cancelling, but it's not going to stop the kids from spreading it to each other. Then they'll bring it home to parents and other children. Futile efforts closing down the school because, as I was saying, I guess it's going to get it anyway. But the schools are told not to lock down. Multiple schools have gone into lockdown to combat flu cases. But the government officials have now ordered schools not to do so, except in extreme circumstances. I wonder why that is. No, keep them open a little bit longer. We need it to spread as much as we can. After being concerned that decisions taken by some head teachers are reminiscent of those taken during the pandemic. That's what I'm telling you guys. Starting to sound a lot like COVID. On Tuesday, Kemi Badenoch rejected all calls for masks to be worn in public, saying she was traumatized by the memory of face mask mandates during the COVID pandemic. Daniel Eccles, the chief executive of NHS Providers, which represents Hospital Trust, had urged people to get back into the habit of mask wearing in the office or on public transport as they did during COVID. The school was approached for further comment, and you can join in the conversation. Should we have a little look at some comments below? No, there are no comments. So there you go, guys. What can I tell you? Schools are closing across the United Kingdom. Christmas has been cancelled for some kids in Middlesbrough. Let's see what's going on in the United States. Next up, KCCI.com, which is a CBS affiliate, I believe, and it says Iowa school district cancels classes Tuesday and Wednesday due to widespread illness. Moulton, Iowa, a southern Iowa school district, has cancelled classes Tuesday, December the 9th and Wednesday, December the 10th due to illnesses. So that was just these last couple of days. In this week, this school in Iowa shut the doors because of a spread of illness. An official with the Moulton Udall School District in Appanoose County told KCCI about 30% of students and staff are out, many with influenza A, aka Subclade K, folks. We will use this time to fully sanitize our facilities and provide a needed health reset for our students, staff and families, the school posted on its Facebook page. Athletic events and other activities are also cancelled, but last month, following the state's first flu-related death of the season, so Iowa has already reported its first flu death of the season, not sure how many more there have been, KCCI spoke to several medical professionals about how to stay healthy this winter. State Medical Director Dr. Robert Kurse issued a statement urging Iowans to talk to their doctors about getting the flu shot and reminding anyone who is ill, or worse, children who are ill, to stay at home. The Iowa Department of Health and Human Services also recommends that Iowans stay at home and avoid social gatherings if your children are sick. Clean high-touch surfaces in your home frequently with household disinfectants. Practice hand hygiene frequently with soap and water or hand sanitizer for at least 20 seconds. Cover coughs and sneezes with a tissue, or if a tissue is not available, cover them with an upper shirt sleeve and not a hand. Keep children home from daycare or school who have fever, cough, congestion, runny nose or sore throat until they are fever-free for 24 hours without medications that reduce fever. If you or a loved one is sick and needs medical care, contact your healthcare provider. Your healthcare provider can offer you on advice whether you or your child needs to be evaluated in person, tested for flu or other respiratory diseases, and the best location for free care or for care. And here is some, sorry about that, I had a little bit of an issue with the screen. And there's just some articles there, I believe, from their Facebook page telling them people that their schools and athletic events had been cancelled. So only a short one, and that isn't actually a video. It's an ad. It looks like when you click on it, it doesn't actually do anything at all. So let's go and see what else we can find and what is up next. We find ourselves now at thedailymail.co.uk, an English publication, but it is about America, funnily enough. A deadly superflu forces more schools to close and triggers hospital restrictions as experts warn of lethal symptoms. And this is by Cassidy Morrison, a US senior health reporter. And it starts out by saying more hospitals and schools across the United States are imposing renewed visitor restrictions and closures amid concerning spikes in a deadly superflu, Subclade K, as experts urge the public to keep watch for warning signs. Cases of the dangerous flu strain H3N2 Subclade K are climbing in more than 36 states. So 36 states, folks. They are on track to overshadow last year's particular severe flu season. Detroit Medical Center has restricted visitor access to protect patients and new staff from spreading the virus. New guidelines limit guest numbers, visitors under 12, and anyone 13 and up who is currently sick. The change comes after masking requirements for hospital staff and visitors in New Jersey and in New York hospitals were reinstated. Cases of flu in both states have been ticking steadily upward since the start of November, following the trends seen during last year's brutal flu season. Following multiple students falling ill during Monday's Mass Villa at the Mass Villa Catholic School in Frontenac, Missouri, and it was shut down, and it cancelled classes throughout Friday for emergency testing and investigation. In a similar move this week, Iowa's Moulton-Udall School District cancelled classes and sports after nearly 30% of students and staff fell ill. Officials labelled the two-day shutdown a necessary response to an extremely high rate of sickness. This year's dominant flu strain is brand new to people's immune systems, making them highly vulnerable and at increased risk of severe hospitalizing illnesses. Public health officials are urging people to keep watch for typical flu symptoms, which tend to come on abruptly, including fever, fatigue, chills, cough, headache, body aches, congestions, runny nose, and coughing. And that is all of the article, I believe. No, it isn't. There is a picture of that school, the Catholic school that closed down, the towers there, in a saint or something in the foreground, a statue of probably a biblical character, Catholic creation, I guess, maybe. But this year's strain has already been dubbed the superflu in the United Kingdom, where it is pushing hospitals beyond capacity, closing schools and causing revivals of COVID-era mask mandates. Told you guys, it's starting to sound a lot like COVID. But in the United States, rates of the flu and flu-related hospitalizations remain low. Overall, they are rising quickly in certain states and counties. Read more. I'm advised virus hunter. H3N2 is unlike any strain of flu I've ever seen. Here's what's causing the havoc. That's an article, not me, professing to be a virus expert, but in St. Louis County, Missouri, where Villa Duchesne is located. Help me out if I'm reading that wrong. New cases jumped at 65% in a single week. So they're up sort of 10% than the ones we're hearing about in England, which was up 55% so last week. So an extra 10% in the United States in a single week, from 29 confirmed in last week of November to 48 in the week ending December the 7th. The total number of cases is currently 141, but a spokesman for Villa Duchesne, which is closed through the end of this week, said Tuesday, "We are taking this situation very seriously and we are committed to the safety of our students, faculty and staff. No classes were held today to allow us to conduct additional testing for peace of mind. All testing results have been normal. No hazardous or abnormal readings were observed in any piece of monitoring equipment throughout the main building." The announcement from Villa Duchesne came mere days after one from the Moulton Oodle School District. There is a picture of the Detroit Medical Center, and it is enacted visitor restrictions, as we've already read in this article, to guard against the virus. New rules limit the total number of guests and prohibit anyone under 12 or any person who is sick. While Iowa's overall flu activity is currently low, the state's health department reported that key indicators are rising. The rate of lab-confirmed cases is following a trajectory similar to last year, which saw a gradual increase before a sharp spike. Hospitals are just as concerned, not just the Detroit Medical Center, but it has not announced a return to masking, but it will limit patients to 2 visitors and no one under 12 is allowed. Visitors aged 13 and over who have a fever, cough or rash are asked to choose another time to visit during a period of wellness. Major New Jersey hospital systems have reinstituted their own mask mandates. Hackensack Meridian Health announced Monday that anyone visiting an admitted patient will be required to wear a mask. So it begins, folks. RWJ Barnabas Health Medical Group, which has 14 hospitals throughout the Garden State, also implemented a mask rule as of last week. Recent data from the New York State Department of Health shows that the flu is now officially prevalent in the state, with over 32,769 confirmed cases and more than 1,743 hospitalizations this season. The department decreed that all unvaccinated personnel in regulated healthcare and residential settings must wear a surgical or a procedure mask in any patient or resident care area. And there is a picture of people wearing masks once again. The flu virus's unpredictability and rapid mutation make it unclear whether H3N2 will remain the dominant strain or become more severe. I'm going to guess it might become more severe. Let me know what your guess is if you are watching live during the premiere or subsequently watching it on your own time. Let me know if you think it's going to become more severe or if it's just going to go away and we're not going to hear much more about Subclade K in the coming weeks and months. But the symptoms and the severity appear similar to those of a regular seasonal flu, which can still be debilitating and disrupt children's education and people's work. Public health experts have advised people to note any new symptoms, including sudden extreme tiredness, body aches, nausea or vomiting, cough and fever. And there was that article all about the United States from the dailymail.uk.
Good evening. Winter has barely begun, but tonight we've had a warning that the NHS is facing a worst-case scenario, December with a surge of superflu. Latest figures show the number of people in hospital in England with flu remains at a record level for this time of year and has increased by 55% in the past week. Health bosses say there's no peak in sight. The surge is being driven by a new strain of the virus and has led to calls from some for those with symptoms to wear masks. Here's our science correspondent, Thomas Moore.
It's been called the flu-nami, a wave of flu cases that's come 5 weeks earlier than normal, caused by a mutated virus called Subclade K. Latest NHS statistics show an average of 2,660 beds were occupied by patients with flu each day last week in England, enough to fill 3 big hospitals. It's a 55% rise from the week before, and the NHS says it's facing a worst-case scenario for the time of year. Most of the cases at the moment are caused by the H3N2 strain of flu. It tends to cause more severe symptoms, particularly in the elderly. There's a version of the strain in this year's vaccine, and there are 2 other flu strains there too. But the decision on exactly which versions of the flu go into the jab is taken in the spring to give manufacturers enough time to make millions of doses in time for the Northern Hemisphere winter. But the H3N2 virus evolved significantly this summer to become Subclade K. The 7 new mutations help it evade the immunity the population has built up from previous infections or vaccinations, so it's spreading rapidly. In a typical year, every 100 people with flu would pass the virus on to 120 others. This year, it's estimated to be 140. But the UK Health Security Agency says it's still 30 to 40% effective at preventing hospital admissions in adults. As for masks, well, the NHS's most senior emergency doctor says that's up to you.
I think at the moment what we're saying to everyone is to be sensible and pragmatic. So if you are symptomatic or if you are vulnerable, you may well want to wear a face mask, especially when you're out and about, and that would be a sensible thing to do.
So how bad could this be? Well, GP consultation rates have been used to track flu for decades. At the moment, they are still well short of the peak reached in the winter of 2017-2018, when there were just over 22,000 excess deaths attributed to flu. The last epidemic was 36 years ago, when more than 1 million people were infected by Christmas. Then there were around 26,000 excess deaths. But even though infection rates are still only classified as moderate, cases are rising steeply, just as resident doctors prepare to strike next week. The Prime Minister urged the Doctors' Union to accept a new offer.
That offer can only go forward if they don't take strike action, particularly in the run-up to Christmas, particularly when we've got a problem with flu. It would be irresponsible of BMA to push through.
This outbreak and the likely impact on the NHS could have some way to go.
We are now at newsweek.com from an article that came out 45 minutes ago at the time of recording. So since I started producing this video, no one's going to watch. This article has circulated, and it says a list of mask mandates in the United States for December 2025. And you can see there, published December the 12th, 2025 at 12:14 p.m. Eastern time. Close that. Sorry about this. As various illnesses have been surging nationwide, a number of states have brought in mask mandates to try and reduce the rate of transmission. Among vulnerable populations, many of the illnesses that have been on the rise in recent weeks can pose risks of severe illnesses, hospitalizations, and in some cases death, meaning measures that reduce transmissions are becoming increasingly important. Why it matters. Oregon's health authority recently said the state had experienced a record number of cases of whooping cough. My goodness, I haven't heard of whooping cough since the 1970s. I thought that had become extinct. But it's also known as pertussis, and outbreaks of the illnesses are also happening in many other states. Cases over the winter vomiting virus, known as norovirus, has also been soaring ahead of schedule this year, with concern raised over whether 2025 will also have high numbers of cases after 2024 hit the highest levels since 2012. COVID-19 cases have also been increasing ahead of Christmas, with 17 states seeing either growing or likely growing number of cases, according to the CDC. While mask mandates can be effective in reducing the spread of an illness, subject to various conditions, including the type of mask used and how they fit, a recent study has sparked conversation on whether improving the quality of air in enclosed spaces could be an important measure in reducing the spread of respiratory illnesses. What to know? The states that currently have mask mandates in place include New Jersey, New York, and California, although not all of these were issued by the state health departments. In New Jersey, there have been a number of health providers issuing mandates rather than the New Jersey State Health Department. The healthcare provider RWJ Barnabas has implemented a mask mandate, as we've already heard, at its locations, which started on December the 1st, which applied to physicians, staff, patients, and visitors. Hackensack Meridian Health, another New Jersey health provider, issued a similar mandate requiring all patients, to team members, and visitors to wear masks at any of its facilities from December. Certain counties in California, including Sonoma County, have also issued mask mandates, although the county issued its mandate earlier, starting it from November the 1st. New York had a mask mandate brought in at the state level, and the New York State Department of Health issued its mandate on December the 2nd, although it is not applicable to all residents in the states. The department has requested that staff and healthcare facilities and agencies who have not received this year's flu vaccine to wear masks in all areas where patients and residents may be present. The mandate comes as the state reported that there has been a surge of cases, up 114% compared to the previous week, as well as hospitalizations that are up by 99% compared to the previous week. So up 100% in the last 2 weeks in the United States there of influenza. What people are saying, Dr. Donald Milton, a professor of environmental health at the University of Maryland, told Newsweek masks, especially worn by people who have the infection as well as those who don't, work really well. They surpass transmission. The tighter the fitting, the better. Don't know why he sounded like that, but never mind. He said whether mandates work depends on whether people agree to follow them. Masks pose communication barriers, especially for people with hearing loss. Social acceptances of masks varies a lot. In Japan and South Korea, they are widely accepted. The same is true in some parts of the United States, but others reject them as not part of the culture. He added, we need to get beyond depending on masks and changes in behavior like distancing or closing schools and bars. I was going to say, we were hearing of schools closing. I don't think they're going to be closing bars and restaurants before the new year. As I said, lots of people spend money in bars and restaurants at this time of year, so I doubt they'll be closing any time soon, but sort of sending kids to school, nobody's really losing out there except for possibly parents in care providers, people who look after kids after school while their parents are still at work. But back to the article. What happens next? They're saying it is unlikely that illnesses such as norovirus, COVID-19, influenza, or respiratory syncytial viruses and others will continue to soar over the winter months, and so other states, counties, and hospitals may look to bring in mask mandates. So there is a fresh off the press article from Newsweek within the last hour, telling you that the increasing amount of states, counties, and cities are beginning to introduce mask mandates in a way to combat a growing rise of not just influenza, Subclade K, but noroviruses, whooping cough we've heard about, and staff. All of these illnesses are becoming problematic and have led to school closures and mask mandates to be reinstated in some states of the United States of America and within the United Kingdom. We are now at PAHO.org. PAHO, for those of you who are unaware of who they are, that is the Pan American Health Organization, the sister organization to the World Health Organization, because the Pan Americans need their own organization. But this is a briefing that they have, a briefing note regarding influenza that they released within the last 24 hours on the 11th of December 2025 at time of recording. It is very small, even with my glasses, and I've bought 3 new pairs of glasses of various strengths to assist me with some of these, and even with my strongest, I can't read what this is saying. But on December the 4th, 2025, the Pan American Health Organization / World Health Organization reported through its epidemiological alert that in recent months the circulation of Subclade K has increased rapidly in Europe and several countries in East Asia. The Subclade K are genetically derived from related viruses, and though a process of natural evolution has accumulated several amino acid changes in their, some more complicated medical word there, but they're just saying it's mutated. But in Europe, influenza actively began earlier than usual for the Subclade K, and it accounted for more than half of the sequences reported between May and November of 2025. In the Americas region, specifically the sub-region of North America, 5 to 7, a sustained increase was observed mainly due to influenza type A. And in fact, the United States of America and Canada, there was an increased circulation of subtype A H3N2 with a progressive increase in detections of influenza A subclade K. On the 10th of December 2025, the World Health Organization reported on its epidemic outbreaks website that the genetic sequence data available from the Global Initiative on Sharing All Influenza Data, the Global Initiative on Sharing, the GISAID, the Global Initiative on Sharing All Influenza Data, we might have to look into that, folks, showed a significant increase in the subclade K in many parts of the world, with the exception to date of South America. Lucky South Americans. East Asian countries are now recording a decline in influenza H3N2 circulation and have not reported a greater disease severity to date. Strains circulating in these countries suggest that they are not different from those in those present in European countries, despite the anti-genetic differences observed in subclade K. Preliminary vaccine effectiveness shows that protection against hospitalizations leaves a similar to previous 70 to 75% in children and 30 to 40% in adults. References: Pan American Health Organization and the World Health Organization epidemiological alert, seasonal influenza in the America region, end of 2025. So this is just references, nothing really important to read, but I did want to include that. As I said, the Pan American Health Organization and the World Health Organization have within the last day released this briefing, and if you come back here, I had to download it. There is that briefing, and the article goes on to say the Pan American Health Organization / World Health Organization is issuing this briefing note to inform member states about the influenza H3N2 situation related to subclade K. So this is a little bit alarming to me. They've named it and now the World Health Organization, Pan American Health Organization have issued a briefing on it, and they have issued this to various regions of the world, and to reiterate the recommendations made in the Pan American Health Organization and the World Health Organization's epidemiological alert on the seasonal influenza and the Americas region, published 4th of December on 2025. So there you go. As I said, this was released within the last 24 hours from the World Health Organization. We are once again at thetelegraph.co.uk for another article that was released a few days ago on the 9th of December 2025. I think that's 3 days ago at time of recording. Badenoch rejects masks in public, and the Tory leader has criticised Downing Street for encouraging people to use face coverings to combat a flu tidal wave. Kemi Badenoch has rejected calls for masks to be worn in public as flu cases rise. The Tory leader said she was traumatised by the memory of face mask mandates during the COVID pandemic, and said the government should not be telling people to wear them to combat the flu. Downing Street, however, has encouraged people to wear masks in public to combat a tidal wave of flu, and the advice came after Daniel Eccles, the chief executive of the NHS providers, which represents hospital trusts, urged people to get back into the habit of mask wearing in the office or in public transport, as they did during COVID. Multiple schools have gone into lockdown to combat flu cases. The government officials have now ordered schools not to do so except in extreme circumstances, after being concerned that decisions taken by some head teachers are reminiscent of those taken during the pandemic. Mrs. Badenoch told Sky News, "I'm still slightly traumatized by all the mask wearing that we had to do during COVID. Let's bring some common sense into this. I personally think that face coverings can be a barrier to social interaction, social cohesion, and I do worry about a mask mandate. I don't think the government should be mandating anything. I think people can make up their own minds. If you are really sick, you should be in bed, not on public transport. I think that's more of a problem. But the truth is, many people are contagious before they realise that they are even ill, so I'm not sure that it would work. I think it's a surprising announcement. I'm not quite sure why they've done that." But Nigel Farage of the Reform UK said, "I don't wear them last time and I won't wear them this time. This is nonsense." Sir Jacob Rees-Mogg, a former cabinet minister during the pandemic, told the Telegraph, "As evidence for face masks was pretty dodgy last time, why should anyone believe in them now?" But the virus has left a record number of patients in hospital for the time of year, an average of 1,717 every day in the last week of November. It is thought to be a mutated version of the influenza A H3N3 strain called Subclade K. There are some more figures. I'm sure we've seen those before, but earlier a number 10 spokesman said face mask was something people can consider, adding there's a long-standing guidance in place for people on a range of measures they can consider taking to help limit the spread of winter bugs if they have flu-like symptoms. This is neither new nor an instruction, but simply something people can consider. On Tuesday, Mr. Eccles told people they need to get back into the habit if you are coughing or sneezing, but if you are not unwell enough to not go to work, you must wear a mask when you are in public spaces, including on public transport, to stop the chances of you spreading the virus to someone else. He told Times Radio, we were all very good about infection control during COVID, and we really need to get back to that now. Asked whether that meant people should wear a mask in the office if they had symptoms. And Mr. Eccles said, I think that would be very sensible to all their colleagues, or probably their colleagues will say, please go home. But we've really got to worry about the fact that this is a very nasty strain of flu and it spreads very easily and very quickly. It is warm and wet out there and people need to be sensible. The effectiveness of masks to slow or stop the transmission of viruses has been heavily debated since the pandemic and is still contested. A review published in 2023 based on the results of 12 different studies assessed how effective different measures were and concluded that wearing a mask may make little to no difference in how many people caught a flu-like illness, stroke COVID-like illness, and probably makes little or no difference in how many people have flu, stroke COVID confirmed by a laboratory test. Mr. Eccles also said anyone who had not taken up the offer of a flu vaccine from the NHS should please go and take it. And if you're not eligible and you haven't had the flu already, it's probably the best to invest 15 or 20 pounds and you could make by going to your local pharmacy and saying, please, can I have a flu jab? Some schools have temporarily closed, as we've heard about in this video, over the past few weeks to stop the particularly infectious virus spreading ahead of Christmas, and ministers are understood to be alarmed by the wave of schools shutting after widespread criticism of closures during the pandemic. A government spokesman told The Telegraph that this will be a tough winter for our NHS, and the latest figures confirm flu cases are at very high levels this year. School attendance is critical for children's life chances, and while it's clear cases of flu are going to have an impact on attendance levels, we are clear that school closures should only happen in extreme circumstances. We provide clear guidance to help parents to know exactly when to keep children home and to help schools both manage children's well-being and keep disruption to a minimum. Sources told The Telegraph that it was up to individual schools to make decisions on health-related closures, but they should think carefully about the impact of lockdowns on children's well-beings. Some head teachers have ordered firebreak school closures and have cancelled singing in assemblies. 3 schools shut for several days, while a number of others introduced measures to tackle the spreads. Experts at UK Health Security Agency urge people to consider wearing a mask if they had symptoms. One of the worst hit schools has been St Martin's in Caerphilly, South Wales, which imposed a temporary lockdown after more than 250 pupils and staff become ill. Pupils reported symptoms that included vomiting, diarrhea, high temperatures, coughs, headaches, fatigue, and general flu-like effects. Lee Jarvis, the secondary school's head teacher, said the firebreak was needed because of significant outbreak of flu-like illnesses, giving time to deep clean the school. During the COVID pandemic, the Welsh government used firebreak lockdowns, short, sharp shutdowns designed to slow the spread of the virus, but the school closed on Friday and was aiming to reopen on Tuesday. But Mr. Jarvis said the situation would be monitored and updates issued to families as needed. Parents were also told to keep their children at home if they showed any symptoms, even if they were only mild. Public Health Wales said the school had done a risk assessment and decided to shut down temporarily. Congleton High School in Cheshire also shut for 3 days between November the 26th and 28th to carry out a deep clean after high numbers of pupils have appeared to have the flu. Simon Kidwell, the head teacher of Hertford Manor Primary School and Nursery in Nantwich, Cheshire, told BBC Breakfast, "We don't know that we can do things to make sure that it's safer in schools, but we've seen schools close close to us in Cheshire close for 3 days, so it has been a real challenge this year." Recent measures are taken to reduce infections at school. I think that might be a map of some of the schools there. Meanwhile, Wigton Moor Primary School in Leeds has reduced singing in assemblies to cut the spread of flu after 1 in 6 children were off or sent home last week. Sir Gavin Williamson, a former education secretary, said, "What we have learnt is that everything that can be done should be done to keep schools open. It is vital to make all efforts to ensure." What's happened? Sorry about that. Seems that we clicked onto another page. We've learned everything that can be done should be done to keep schools open. It is vital to make all efforts to ensure you've got continual education, as the people most impacted by closing schools will be children. Every study shows that children are always best off in schools where they have the opportunity to learn with peers in front of teachers. The evidence of COVID outbreaks point to that. Earlier this month, the COVID inquiry found that closing schools during lockdowns brought ordinary childhood to a halt, she said. The decision to close schools had a profound consequence on children and was a step taken to protect the adult population. And that is it from the telegraph.co.uk, and I think that is where we will leave it article and video wise for today, and head back over to the virtual basement to wrap things up. So that is all about it for this evening's instalment of Unwatchable Content. And for those of you who have paid attention and did watch RD this evening, the echoes of COVID are getting incredibly louder and increasingly louder by the week since we first started reporting on Subclade K just over 3 weeks ago. Now we have seen an increasing rise in hospitalizations, and not only that, we are seeing some very, very similar preemptive precautionary methods and mandates being introduced to prevent the spread of this Subclade K super mutated variant strain of influenza from running rampant. And as I've sort of mentioned at the outset of this video, I don't expect there to be anything dramatic or drastic this side of Christmas, as we've already established that it is the most busiest time of year commercially, and with many people out and about shopping in stores, trying to get those Christmas presents and all the other sort of stuff that goes along with the providing for the family for the holidays. There's going to be an awful lot of people out and about in stores, shopping malls, as well as there's going to be an awful lot of people traveling to and from family in various parts of the land. So we're experiencing not only a busy shopping time, a busy travel time, and with conditions already ripe for influenza season, and with influenza season arriving considerably earlier than expected, and already causing more cases than they were hoping for. What lies ahead in 2026, we will have to be patient and wait and see once the sort of holidays and the new year are over and done with. But I would sort of expect that this, if it is going to take a similar trajectory to that of the COVID one, it will be possibly around about February and March before we start seeing if or not this is going to develop into a pandemic or not. But the early signs are suggesting that it quite possibly could go that way, and with schools shutting, hospitals introducing mask mandates, unvaccinated staff being urged to go out and vaccinate themselves. People who are already unvaccinated are also being urged to get vaccinated, which is the message that we are hearing in all of these publications and many articles that we have explored within these 3 episodes regarding Subclade K have all been reading from the sort of same script, which is why I didn't go into as many today as I was intending to. But there has been an uptake in articles. There's an awful lot more people mentioning Subclade K in, just within the last 24 hours or so, probably 36 hours by the time you get around to watching this, by the time productions and editing have finished. The World Health Organization / Pan American Health Organization have issued a briefing regarding Subclade K being on the rise, in the next sort of step in that sort of COVID scenario as it was schools and hospitals were being a little bit precautionary, and sooner or later it led to bars and restaurants. And another sort of thing people tend to do a little bit more often than not in the holiday period is go to bars and restaurants, go and maybe treat themselves to a meal, sometimes go and have a few drinks with friends that we haven't seen for a while on Christmas Eve, or spend the evenings in discotheques and bars seeing in the new year. So there's going to be a lot of people congregated and in close proximity, and hearing that schools are cancelling assemblies to prevent kids from singing in order to spread this virus. It seems as though it is only just begun, and as the title of this video was it starting to sound a lot like COVID, I would be extremely interested to get some contextual feedback from anyone that has watched and paid attention to this latest unwatchable video. If anything is being mentioned and spoken about Subclade K in your local communities and proximities. Obviously we've heard of New York, New Jersey, London, as well as sort of California, Illinois, some very big states, but at a localized level, in more small towns and smaller villages and hamlets and stuff where some people may be watching from. Let me know if anything's being mentioned or talked about Subclade K in your local vicinities, and if or not you have friends or neighbours or family that are starting to talk about this, because up until now, although we are seeing that there are articles and there are news reports about it, I've yet to sort of see any sort of YouTube channels sort of within this genre mentioning or speaking about Subclade K as of yet. So as I said, I'd be very, very interested to hear what you guys have to say and what's being said in your local neighbourhood regarding this latest variant mutant super flu Subclade K, although I do understand and I'm extremely aware that expecting any contextual comments or feedback are extremely rare, and it was only in my last video I asked as a very humble request, as a way of showing your gratitude for my efforts and endeavours bringing you shit video productions, videos that nobody watches. Would you be as so kind as to go and leave me a comment and let me know what you thought of the video? And not a single person did so. So if or not that was a finger up to me, or the fact that no one was really paying attention, I won't waste too much sleep trying to work that out. But it is a sort of almost foregone conclusion for me, at least, that once I do finish production and editing these videos and finally get round to uploading them, the fact and likelihood that anyone getting round to actually watching this in its entirety, and anyone that sort of does watch it in its entirety during the live premiere, tends not to pay as much attention to the content as they do to countless hellos, endless blessings, and usually gossiping about anything other than what I am trying to talk about. So that being said, folks, let's leave it for this evening's unwatchable installment of No One Watches RD, and hope that anyone who did pay any attention and listen to this video, you will be leaving me a little bit of a contextual feedback and let me know what's going on in your neck of the woods regarding Subclade K. But that's it, folks. All being said and done, all that I need to do really now is to thank those of you who have watched RD this evening, and until next time, remember to be excellent to each other. May the force be with us all, and take care until I see you again. This is RD signing out for now.
Sit, Ubu, sit. Good dog.
Be excellent to each other. Party on, dudes!
Hey, Luke. May the force be with you.
All right. Take care now. Bye-bye then.